In 2008, I lost my job. And at that time, I lost my health insurance. And I have type 1 diabetes, okay? And with type 1 diabetes, you cannot lose health insurance. And when I lost my health insurance, I couldn't even make an appointment with my doctor, who at that time I had been seeing for 10 years. And I was in a real crisis. I was in a real health crisis. I was in a personal crisis. Cornell Scott was the only health organization that I could even make an appointment with. Like, imagine that. Imagine that.
What we offer at Cornell Scott is we offer another level of caring, another level of being present with that patient and taking that extra step to make sure that they're going to get what they need to get.
The providers or the clinical staff work really closely with the front desk and the operational folks to make it so that patients are never turned away.
Cornell Scott is a beacon of hope seen to our patients because it is a judgment-free zone. It's a welcoming place. We see everyone. Nobody's turned away here. Everyone is seen and everybody is kind to patients, and patients are so appreciative and excited to come and see us. And that's why I love working here.
My experience here has been very profound. As I said, I came here very, very sick. And I've always been invested in myself. Thank God for a very strong family and a very strong family connection. And it taught me how to stand up for myself and how to fight for myself. And when I got with this particular team here at Cornell Scott, they were willing to fight with me. So that's what made the difference for me, that I had somebody who was listening, and I had somebody who was working and had the same purpose that I had, and that was for me to get well.
In our community, if you say that you're going to Cornell Scott, it means something. It means that you're going to a place that's been there for a while, but it also means that you're going to a place that is a group of people that is caring every day. We don't take days off from caring. And I think that people know that about us. And I think that when providers see patients that have been treated at Cornell Scott, I think they're secure in the knowledge that they've been treated well and they've been treated appropriately for all their medical conditions. And I think that just goes to speak to how terrific our providers are.
I think people come to work at Cornell Scott knowing and understanding the mission, very much believing in it. And many of our staff, including providers, are from this community, so want to give back to our community, and I think that's why we do so well. We stick with it.
I was born and raised here in New Haven. I've been here all my life. Spent almost all of my growing up years in the New Haven, in the East Rock neighborhood.
I grew up in New Haven. I live in New Haven. My children are in public schools in New Haven. I want to be a part of a community that is fun, healthy, safe, economically viable, and has a growth mindset.
So Cornell Scott's track record and reputation is something that patients are coming here for. We're kind, we're open, we are wanting to help people. And I think that's really comes across to patients. They come back because they know we want to see them and help them. And that's the kind of people that we hire at Cornell Scott.
When I came to Cornell Scott, and as I got to know the people that we serve, I realized that it really wasn't about helping people. It was about getting to know them and getting to love them and getting to know their personalities and being a part of their lives.
The wide range of services that we have here available allows me to give the most comprehensive care to our patients. It's a one-stop shop for most of our patients. It's convenient for them to not have to travel around the city to different office sites, and it allows for streamlined communication. So I'm able to communicate really quickly and directly with providers in these other specialties if I have a concern about a patient or if I'm just trying to help them get access to care. So I think it's amazing to provide fully comprehensive medical care.
We have many different specialties here at Cornell Scott, and we're able to work with them directly, such as ear, nose, and throat, dermatology, podiatry, and other specialties here at Cornell Scott. The implementation of electronic health records around not quite 10 years ago, but it has been so helpful because it allows us to communicate with our colleagues on a regular basis.
Having all these services co-located helps people really in terms of time and convenience, but also in terms of expertise, because these areas we're able to communicate with our colleagues in these other departments, and we're able to communicate some of the needs of the patients that the patients may themselves not always be able to communicate the same way.
As a patient, I learned what it's like to be treated with care and dignity when you're vulnerable.
We have a very diverse patient population. We see, kids from age 6 months all the way up to, 99, 100. We're helping all patients. So it's a one-stop shop. We're not, we are seeing everyone. We don't discriminate, and that's wonderful about Cornell Scott. Everybody sees patients. There is no age limit. There is no restrictions. Everyone is welcome here.
The reputation of being a full-service healthcare organization, having dental services, behavioral health services, women's health, pediatrics, to where a family can be seen in multiple departments and have their healthcare needs met, I think is tremendously valuable.
Behavioral health here is an incredibly strong and supportive team. We're very fortunate to have them. And internal medicine works very closely with behavioral health on a day-to-day basis on individual patients. For example, we have Microsoft Teams chats where when we have an emergency situation where we need immediate help from our behavioral health team, we can chat that team. They will come immediately to the patient's room to support us and the patient. I think this is very unusual in a community health center, and we are very fortunate to have them.
I had a patient come in, and a patient who had been with us who said, "Wow, I'm so excited that this space is for me to come for my care." And I will never forget, it's so important, not only the space, but the people and the relationships that we build in caring for our patients.
Cornell Scott really focuses on compassionate care, focusing on seeing patients who don't typically have good access to health care, people who are underinsured or who lack health insurance. And that drew me in.
It is really an incredible organization that has been created here. There are multiple teams, not only primary care, but specialty services readily available to help all of our patients. Behavioral health, like we said before, our support staff is always ready to answer and help all of our patients. We're on call 24/7 for our patients. We have an eligibility team to help with patients who need assistance with care, paying for care, care coordination. It's really incredibly comprehensive what we have here for our patients, and I think patients are aware of this and appreciate it.
How important this partnership is to train the next generation. And that's where the education component comes in. When we have residents and students that are learning about what is a federally qualified health center and how impactful it can be and how needed it is to have really dedicated doctors, clinicians, team members that engage with the community, I think it's setting us up to maybe facilitate and perpetuate that connection, right? So the next generation is going to say, oh, this is how I can be really make a meaningful connection and impact on the people I care for.
We not only treat the medical condition, but the person behind the medical condition. Our tremendous social service coordinators are always trying to figure out, all right, what else does the patient need? Do they need access to the food pantry? Do they need information on housing? What else can we do for this patient to make them feel whole? And I think that just like any type of beacon where you're guiding people, I think we guide people. And I think we're always trying to do the right thing. And I think it's a special relationship that patients have with the Cornell Scott Health Center.
I'm just really proud of what we do and the people that I have the privilege of working with here every day.
Very kind people who really do work hard and focus on providing empathetic and compassionate care.
We're going to treat them like we would be treating our own family. And I think that's probably something that in this day and age is greatly needed, is that when people come in, they know that we're going to be treating them like they were our brother or sister.
I don't know of any other health centers around that have all the services that we provide here. I think we are a hidden treasure, right? I think we are a sometimes unseen gem. But I really appreciate the leadership that we have now who has put us in the forefront.
The city of New Haven has gone like this in the last 20 years, and it's going to continue to go like this. That doesn't happen without Cornell Scott. Cornell Scott is the actual denominator that keeps this entire community afloat. And that's every single person that lives in Southern Connecticut, every single person that loves New Haven has to understand that the care that's provided by Cornell Scott is the very foundation of the growth of this community.
Families realize that you can stay in one place and make things better. You don't necessarily have to look somewhere else to find better things. And we were able to, with our stability and our perseverance and our consistency, I think we show people that with a lot of hard work and positive energy, you can make progress right where you are. Just keep working at it.
People trust the organization. They know they can bring any family member here and get good quality care, and a welcoming environment, and it's just a wonderful place to be.
Cornell Scott provides care to people who really need it.